Good afternoon. My name is Frank Doldo, and I'm the Chief Transportation Officer for Tompkins County. Today, what we would like is your feedback on what we found as transportation barriers, the current transportation modes, and some strategies to help break down those barriers to get people to social determinants of health. So your feedback is very important to us. So let's talk a little bit about what is mobility management. Mobility management is customer focused. It solves transportation barriers to get people from point A to point B. It develops and implements programs and services to break down transportation barriers. It informs the community on transportation modes, and it develops and implements a travel training program so that people that are a little apprehensive of using different transportation modes in Tompkins County can receive training to make that apprehension less stressful in their lives. We're going to be talking a lot about social determinants of health in this vision plan. So what social determinants of health in the transportation world is getting people to employment, getting them to food pantries or grocery stores, getting them to education, whether it be college or BOCES or a workshop that's going to help develop their skills, and also to get them to healthcare appointments and enjoy recreation in Tompkins County. So here's just some of the barriers that we have. I encourage you to go to the website and look at the complete plan. So some of the barriers are limiting rural access. So not a lot of people really know what transportation options are available in Tompkins County, especially in the rural areas. Underserved and low-income communities lack information about what those options are and how to navigate through those systems. There really isn't out-of-county travel options to see medical specialists. So we found that as one of the high markings of some of the barriers in Tompkins County. The recent suspension in public transit routes have further limited the options that are available to Tompkins County residents. And the other piece, especially in rural communities, is how people get from their homes to the closest bus stop when the closest bus stop could be 5 to 10 to 15 miles. So here are some strategies that we're thinking about, but again, we really want your input and feedback on ideas that you all have. One is to develop and implement a one-call, one-click transportation information center, where Tompkins County residents and visitors can go to one website, download one app, have one phone number to call, to schedule, to receive information, and to line up their transportation inside and outside of Tompkins County. In order to strategize on breaking down the barrier for information, we want to develop a mobility management program so that that information can get out there to rural and low-income communities in Tompkins County to give them the information they need to get them from point A to point B. We want to assist TCAT in ridership, so we're going to be talking a little bit about first mile, last mile program that we'd like to implement. We believe that once that program is implemented, it'll get greater access to rural underserved communities to get to TCAT buses and bus stops to get them to and from their location. We understand that there's limited transportation modes, and we want to expand that. So we want to start building partnerships with a broad group of key stakeholders and create a more robust and inclusive transportation system. And then we're going to talk about in a minute, we'd like to pilot two programs. One is called First Mile, Last Mile, and the other one is called Rides to Recovery. So what First Mile, Last Mile is, it's connecting people, Tompkins County residents, from their home to the nearest bus stop so they can take TCAT, to the nearest car share so they can pick up a car and drive where they need to go, to get to bike share for those that like biking, to get them to a bike share location from their location to and from. The second pilot program that we would like to implement is called Rides to Recovery. I've developed Rides to Recovery in 2 other rural communities in upstate New York. What this program does, it provides transportation support for people in active recovery for substance use disorder and mental health. It gets them transportation to social determinants of health. What we found in the other 2 rural communities that I implemented this program is the top 3 components of what people use this program for was employment was number 1 in both counties. Food access and education were 2 and 3. So we're anticipating that these top 3 are going to be the top 3 that people will use this program in Tompkins County, but we don't know yet. But we would like to pilot it, test it out, and see what works. So here's the timeline that we're anticipating with everybody's approval, with everybody's input. And again, this report is a draft report. We want to incorporate your feedback into this report. So please, please, please give us feedback, and I'll show you at the end how you'll be able to do that. So our timeline for the mobility management one call, one click center, we're looking at late this summer, releasing an RFP, awarding it in the fall, and having a start date in January of 2025. During January through December of 2025, I'm going to be doing outreach to area nonprofits, other transportation modes to see how we can all work together and develop a robust transportation system in Tompkins County. And then sometime in 2026, I just talked about the Rides to Recovery program and the First Mile, Last Mile. Hopefully sometime in late April, we'll award the contract and we'll start doing a soft opening. And what I mean by a soft opening is we'll use a few agencies, we'll use some Tompkins County residents to test out the system so we can work out all the bugs and have a really great program when we do a full launch, hopefully sometime in late fall. So how are we going to evaluate this and determine if it's going to be a success or not? We're going to continuously have meetings with key stakeholders. We're going to have data, real-time data and analysis throughout the time periods that I outlined. And we're going to continue to understand the challenges and opportunities facing low-income underserved areas of Tompkins County and see if these services or the services that you would like to see when you give us feedback that are needed in these communities to help people get access for all. So that is my short presentation. I encourage you to read the full draft report, click the survey link, and fill out the survey and give us your feedback. Look on the website so that you'll be able to watch this presentation over again, get more ideas flowing, and submit the survey with all your ideas and recommendations and tell us what you like and what you don't like. You also can email me My email address is fdoldo@tompkins-co.org. That's fdoldo@tompkins-co.org. I really appreciate you taking the time to watch this, and I really am looking forward to your feedback. Have a great day.